OET speaking. In OET speaking, you are mapped on your language skills and also on your clinical skills. Language skills is how good you are in your speaking fluency and how you can use the right grammar. And it should not be too fast. It should not be too slow, but you should have to keep a medium pace. Clinical skill is how effective you are as a listener and how effectively you can answer to the patient's questions and clearly give them the answers. Do not be judgmental. For example, if they say that they are into excessive drinking, don't be judgmental when you ask questions. So, and above all, always be polite when you want to get information. Say, excuse me, can I? After getting the information from the patient, you have to say, thank you for information. Students, don't forget that, okay? Then, how do you initiate the conversation? See, tomorrow for the mock test, I will be giving you the actual a copy of what will come for the exam. Meaning that we'll start with the role play, with the warm up, and then go to the role play. So I think it's good for everyone to just recap everything. So first of all, when you begin the conversation, it is you as a candidate who have to introduce yourself, saying, I am Deepa, who will be attending you today, and then clarify your role. I'm Deepa, one of the nurses in this emergency department, and explain the nature of interview if necessary. Sometimes in the background, they'll say, you have come for pre-operative assessment, or you have to come to assess the patient. In that case, you can say, well, I have come to check on your progress and to assess your vital signs. All that, whatever is given the background, if you want to use it, you can use it. If the role play demands that, then greet the patient. Hello, Mr. Tom. It's Mr. Tom. Is it right? Can you tell me when do you say like this?
It's a
known case. Yeah, especially where it's in a known case. When you ask in a known case, you can ask the patient's name during the preparation time. Okay. In that case, you can just begin the conversation. Hello, Tom. How are you feeling? You can address them by name, or even if it's unknown case, you can ask the patient the name during the preparation time, and then you can say, even if you ask the patient the name, you have to restate it because you don't know the patient in advance, isn't it? So you can say, can you restate your name for the record, please? Can I have your name for the record, please? You have to ask once again. Or another option is you need not necessarily ask the patient during the preparation time. If it is an unknown case, you can straight away ask the patient's name. If it is an unknown case, when you begin the dialogue by saying, can I have your name for the record, please? Did you understand the difference between that? I'm the community nurse. Welcome to our practice. If it's a clinic, you can say, welcome to our practice. Then, as I told you earlier, as the role play demands, you can say, I'm here to give you advice regarding your dietary pattern, or I've come here to give you the details about discharge as you're getting discharged soon, depending on the role play. Then throughout the role play, especially in the first two tasks, not the first task, second and third task, probably you'll have to get a lot of information from the patient. Isn't it? Yes or no? Yeah, especially in the second and third task. That is when you ask a lot of questions from the patient. Then always, it is good if you begin, I would like to know, could you please, would you mind telling me? All these are simple, which you can use, because find out or ask, all these verbs will be in the task. Okay. So don't just ask, but you can say, can I know? Would you mind telling me? Please write it down if you don't have at least take a screenshot. It'll be useful for you. Now, sometimes if you want to get some more information, or then the verb will say, the task will address check or determine. If you get something like that, I would like to check whether, or if it's something like determine, can you tell me about your medication usage or your smoking habits? Once you get the information from the patient, say, thank you for your information, and then you give back the information to the patient, isn't it? Then the verbs will start with explain, advise, recommend, outline, suggest, discuss. It all means explain. Now that you have told me, this is usually used when you use some information which the patient has given you. Now that you have told me about your smoking habits, I would like to suggest some measures to overcome the habit. I would recommend that you use nicotine patches, all that. All the points will be given in the bulletin, in the task. You can use them. Change the patient's mind. So we have seen in many role plays that sometimes the patient is not cooperative to the nurse or the doctor. In that case, probably it is because they don't realize the seriousness of it. So in that case, you have to persuade, which means you have to really force and tell them, convince them, emphasize, give them the importance of continuing the treatment. Stress, this is very often seen in the task. Stress here means make them understand, give importance and say, reinforce, make them understand, promote. That only comes very rarely. Express concern. You can say, oh, well, I'm afraid if you don't continue the treatment, it can adversely affect your health. Convince, you have to make them convince. So how do you, when you get these tasks, and when you see these verbs, it is very important that you have to use strong language to make them convince. So you could use this. I understand that it must be difficult for you to change, but I want to stress how important it is. I understand that it must be difficult, but it is critical that you follow the treatment. It is really important that you continue the treatment. Surely you need to continue the treatment. Clear? See, when I give you a list of this, you can select one or two which you like and write it down and probably use it for your next meeting. Okay, so that there is a change in your usual style of talking. Yeah, this is something, reassurance is something which you have to give throughout the task. Especially, I would say, you begin the question. It is the nurse who starts the dialogue, isn't it? And you ask the first task, like for example, can I know the reason why you're here? Or the other option is, can I confirm that you have come for the preoperative assessment? These are the two options, isn't it? So in that case, the patient will tell their complaints. Students, remember, before going to the task number 2, what should you do? You have to immediately give them reassurance after the patient address their complaints. How do you say that? Well, there is absolutely nothing to worry. We are here to help you. We are here to support you. Only then go to the task. Even now, many students, they rush to the task too. I don't know why you all rush. Remember, once the patient addresses their concern, it is your duty. Don't. We give you the right treatment and we are here to support you. Only then go to task number 2. Task pattern. You know that now the tasks that comes recently are not simple tasks. It is not one word. It may be multiple questions in one task. It may start like this. Give information about the dash. Then you see a full stop. Same line you can see another fresh sentence. Advise the patient regarding the, then full stop. Then find out or explore. Explore meaning find out in recent incidents. So when you get 3 different multiple questions in one task, you have to address, take them one by one. And now recently what I noted is, I don't know, some students, they simply, choose the bulletin points here and there and they talk. Never do that. You can rephrase the bulletin points. When a bulletin points is given, you don't have to say that in order, you can rephrase. But don't ask from here and there. Go step by step. Finish the task 2 and then go to the task 3. Do not use the information from the task 3 and then go to the task 2. Did you understand? Because it will be very confusing. And there's a chance for you to miss out many points. So never do that. Just go take one by one. So when you give information, well, how do you begin? Well, I shall explain in detail about, and then you go ahead with the explanation according to the task and the bulletin points. When you have to give an advice, well, let me advise you regarding the risk. That is how you can begin. Find out, explore. Can I know if you had any recent incidences related to what, skin infection, or any kind of infection. Yeah. So remember to deal with the task one by one. Now let's go straight to this. This is our task for today. Yeah. So I want one person to read from the setting till the nurse background. When you read, please remember, read very slowly and clearly so that the others understand. Because in this group, there are students from different backgrounds. Some can pick up fast, some are slow to pick up. So we have to respect them also. Okay, start.
Setting pre-surgery clinic. You see a 60-year-old patient who is going to have an operation on week. He or she attends the clinic for a pre-operative assessment and wants more information about the MRSA screening. Task: confirm reason.
So yeah, so let me explain. So what is the setting? It's a pre as a 60-year-old who is going to have an operation on his or her knee. So you have to first of all decide whether it's a he or a she. Okay, on he this week, meaning that he's going to have a knee operation sometime this week. So he is attending the clinic for pre-operative assessment and wants more information about MRSA. You also say MRSA, isn't it? Methicillin-resistant Staphylococcus aureus screening. This patient wants to know more about that. That is why he's come here. Okay, can one person read just the first task?
Confirm reason for patient appointment, preoperative assessment before knee operation. Find out if patient has any question.
Yeah. See, this is when I think students can mistake slightly between find out the reason. Please write it down. Find out the reason. I want everyone to write it down. Find out the reason for patient's visit. And the next line you write, confirm reason for patient's visit or appointment. Do you see a difference between these? In the first, it is find out, which means the nurse who's attending you does not know the reason why you're coming. Do you understand? So it is fine when you find out the reason for the patient's visit. Can I know why you are here? Can I know the reason for your visit? But when it is confirm reasons for patient's appointment or visit, which means that this nurse or the person who's attending you already knows that you have come for something. So you are reconfirming it once again to the patient. So it is good if you say, can I confirm that you have come for your pre-operative assessment? Isn't that fine? So you should not ask, how can I help you? It's very wrong. It's big wrong. To say, can I confirm that you have come for this? Yeah, so confirm reason for patient's appointment, pre-operative assessment before knee operation. Yeah, so how do you begin? You can say, good afternoon. That's how you begin. So you know that in an OET exam, it is the candidate who needs to initiate the conversation and it is not the interlocutor. So it is your duty to start when your time starts. Say, good afternoon. Yeah, see this, since this is an unknown case, how during the preparation time, how do you start? First of all, when you get the question paper, the first thing you have to do is take a pencil, note down the main points. And then once you're settled, you can look up to the examiner and ask, how can I address you during the role play? It is quite natural that you as a candidate will be stressed. So in order to be free from stress, please write down the name she's saying. Otherwise, finally, you end up talking someone else's name. Yes or no? Because it can be confusing. So once the patient tells the name, please write it down so that you're safe. Because I have seen many students, sometimes they get so mixed up, they start using other names. So that is point number one. And then when the time starts, we can say, you already know the patient's name in advance, but you do not know the patient in advance, isn't it? Yes or no? Because it's an unknown case. So how do you begin? Good afternoon. I am Anu, who will be attending you today. Welcome to our practice. See, I'm sorry, it's an unknown case. So how do you say? Good afternoon. I am Anu, who will be attending you today. Welcome to, I'm not wrong. Then you can ask, can you restate your name for the record. Suppose if you have not asked the patient's name during the preparation time, how do you begin? You begin by saying, "Good afternoon, I am Anu. Yeah, who will be attending you today? Welcome to our. How can I address you? Can you tell your name, please?" Straight away you can start. And then come to the first task. How do you say? "Can I confirm the reason for your appointment regarding pre-operative assessment before knee operation?" Question mark. Yeah. Then you also have another task. Then, then my answer will be, well, yes, I have been told that I have to come here to get tested for this. I say that is my answer. Okay. Then your next task is find out if patient has any question. Well, you can always begin like that. Well, do you have any other questions? Or do you have any other concerns? Then I'll say, oh, well, I don't understand why I have to go through the screening. That is my doubt. But then I, as a patient, will say, I don't understand why I have to go through this MRSA test. But that is why, I'm confused. That's why I'm here. Then can someone read the second task for me?
Give information about MRSA, example, common skin nasal bacteria, resistant to antibiotics.
1 minute, harmless.
Harmless to health people, causes complications for surgery, recovery, etc. Describe purpose of MRSA screening, example, infection, control in hospitals, etc.
Okay. Please, I've seen some students using example, etc. Please don't use that. If you so etc. Instead of using that, if you want to add 1 or 2 points on your own, you can add. Please don't use examples, but you can say like, for instance. Did you write it down? For instance, like, as. These are some of the words alternatives. Please stop using etc. Even the other day, some students were using that. So when the patient says, I don't know why I have to undergo this test, how do you say? Give information about MRSA. You can say like this, well, don't worry, I shall explain regarding MRSA, or I shall explain a little bit about MRSA. See how I'm going to build up the sentence. Students, please note how I'm going to build up the bulletin points. It is a common skin or nasal bacteria which is resistant to antibiotics. It is harmless to healthy people. However, it can cause complications to people during surgery and during the recovery period. Yeah, I shall repeat once again. It is a common skin or nasal bacteria. Please look at the bulletin points. See how I'm going to develop it. That is what you need to understand. It is a common skin or nasal bacteria which is resistant to antibiotics. It is harmless to healthy people. However, it can cause complications to people during surgery and during the recovery period. Now we are going to the next task. Describe purpose of MRSA screening, infection control in hospital. The main purpose of MRSA screening is for infection control in hospital and for better patient care. You can also add like that, or anything that you think will suit. Well, the main purpose of MRSA screening is for infection control in hospitals and for better patient care.
Ma'am, this thing is from example for infection and control in hospital, no, ma'am, this paraphrase.
Yeah, I'll tell you. The main purpose of MRSA screening is for infection control in hospitals and for better patient care. This is what I added, because otherwise I thought it would be too short. See, instead of extra, see, I did not use etc. But instead of that, I use some point that suits the sentence. And also for better patient care. Did you understand? You want to use something, try on your own. Don't say etc. Then my answer to that is, okay, now the reason for MRSA screening is clear, but I want to know what the screening involves. That is my next question. So, okay, I want someone to read the third task.
Example, swabs from nose or groin sent to laboratory for testing, results within a few days, etc. Find out any other concerns.
Okay. Well, all right, don't use well throughout. All right. I shall explain the procedure for MRSA screening. Students, I want you to don't be in a hurry to write the notes alone. Look at the task and see how I'm developing. That is what is very important. Well, all right, I shall explain the procedure for MRSA screening. The swabs. How do you pronounce it? Swabs. Say, swabs are taken. The swabs are taken from nose or groin and is sent to the laboratory for testing, and the results will be available within a few days. Well, I shall explain the procedure for MRSA screening. The swabs are taken from the nose or groin and is sent to the laboratory for testing, and the results will be available within few days. Clear? Then I'm coming to the next task. Find out any other concern. Then after one break, I'll say, do you have any other concerns? Then the patient's concern is, okay, I want to know what will happen if the test confirms that I have the bacteria. This patient is asking, if the MRSA test is positive, what will you do? Can someone read the next task for me?
Explain next step. If result is positive, prescription for an antiseptic body wash, extra hygiene measures, ointment for nostrils, 5 days, retest,
etc. Okay? Yeah. So then when the patient says, what if my test turns positive? What do I do? Then you can say, they explain the next steps if the results are positive. The prescription of antiseptic body wash, all that. I'm going to build up, okay? Listen. I'll say, don't worry. In case your result is positive, okay, once again, don't worry. In case your result is positive for MRSA. Please say like that. Please be explanatory. In case your result is positive for MRSA, you will be prescribed antiseptic body wash. Use a linking word, connector. In addition to extra hygiene measures. Did you see how I've used the connectors to link both these? Then again, you see comma, no? So it is telling about another point. So again, it's good if you use a linking word like, say, besides or along with that, you will also be given an ointment which needs to be applied in the nostrils for 5 days, after which is again a connector, or following which you will be retested. I've given you two options. You can either use after which or following which. Okay, listen. Besides, you will also be given an ointment which needs to be applied in the nostrils for 5 days, after which or following which. Please use only one for the examiner. Following which you will be retested. I hope it's clear. See, use these fillers, okay, so that it removes the gap. I hope it's clear. Then my doubt is, the patient's doubt is, see, even if my test, I am worried if I might get an infection from the hospital, and then I will not be able to have the operation. That is the patient's worry. So how do you answer to that?
Reassure the patient about just to prevent spread of bacteria, strict cleaning regime, for example, antibacterial hand wash, sterilization of equipment, monitoring of facilities, establish patient's consent to have screening.
Yeah. See, sometimes you may not understand. Sometimes you may not understand. For example, monitoring of facilities. You don't know how to build up, no? It can be confusing, but let's see how it goes. Then I'm saying, I'm worried, what if I get the infection and my operation will be, will not happen. So in case of that, what do? Then you give assurance to the patient about the precautionary measures that will be prevent all the spread of bacteria. Listen, well, there is nothing to be overly concerned. We will be taking precautionary measures to prevent the spread of bacteria. Now they're going to say the different examples. Okay, what they're going to do, which includes, you have to use all these, which includes strict, now look at the task, strict cleaning regime. Now they're going to say the examples. What are the regime they're going to follow? As using antibacterial hand wash, sterilizing every equipment we use, sterilizing every equipment we use, then use a connector. In addition to monitoring of facilities here, what I understand is maintaining, ensuring high level of cleanliness and hygiene. Okay, you'll understand. So instead of saying just monitoring of facilities, the monitoring of facilities can be anything from maintenance of equipment, repairs. It also includes maintaining, ensuring high levels of cleanliness and hygiene. So I think that is more suitable here. Yes or no? Yeah. So you can say like this, as using antibacterial hand wash, sterilizing every equipment we use, in addition to, that is a connector, in addition to monitoring of facilities. Instead of that, you can say in addition to ensuring, in addition to ensuring cleanliness and hygiene, that is enough. In addition to ensuring cleanliness and hygiene. Are you clear? Then you can ask the patient, are you clear? Then the next question. Now, establish patient's consent. You can say, now, can I have your consent to go ahead or proceed with the screening? When you say that, the tone should be like a question mark. Now, can I have your consent to go ahead with the screening? See, the tone should be high. There should be a voice modulation. Then I'll say, yeah, now everything is much more clear now. Well, you can go ahead with the screening. So your task is over, my task is also over. But how do you end it and wind up beautifully? So now that the task is over, it is your duty as a candidate to ask once again, apart from these, do you have any other concerns? Then the patient will say, or the examiner will say, well, thank you so much for your explanation. Then you say, thank you. Give it a high pitch, okay? Don't say thank you. It's very depressing. Thank you. That is it. That is the end of the role play. Then immediately you'll be given another role play preparation. Was it clear?
Yes, ma'am.
Yes, ma'am.
Yeah, this is also something which we have not done before, isn't it, students?
Yes, ma'am.
Something new. Yeah. So now we are going to have a replay of it, and I want everyone to participate. Okay. Suppose even if you start together, two of you start together, don't worry. Let the first person talk, and then you can continue. You can follow. So shall we have a replay of it? Yeah, you start. I'm ready. Should I call the names?
Good afternoon. My name is Donna Joseph, who will be attending today here. Welcome to our practice. How can I address you?
I am Anu.
Okay, Anu. Can I confirm the reason for your visit is pre-operate assessment before your knee surgery?
Is it? Okay.
Is it correct? Yes.
So can another person also repeat that, because she's not, the range is not right.
Good afternoon. My name is Bindu Augustine.
Bindu, carry on.
Good afternoon. My name is Bindu Augustine. I'll be taking care of you today. How can I address you?
Okay. I am Anu.
Well, Miss Anu, can I confirm the reason for your appointment is for the preoperative assessment before the knee operation? Is that correct?
Yes. I have been told that I need to get tested for MRSA.
All right. Do you have any questions related to that?
Of course, because I don't understand why this test is necessary for me? I'm really confused about that.
I can really understand your
No.
situation.
Can you give, can someone else take over?
Well, don't worry. I shall explain regarding MRSA. It is a common skin or nasal bacteria which is resistant to antibiotic. It is harmless to healthy people. However, it causes complication during surgery and recovery period. Are you getting my point, Anu?
Okay.
Okay. The main purpose of MRSA screening is for infection control in hospital and for better patient's care. Are you getting me, Anu?
Okay. Yeah. Well, now the reason for MRSA screening is clear now, but I would like to know what the screening involves. Can I know more about that? Someone else?
Yeah, definitely. I will give you information about the MRSA screening. May I?
Okay.
The swabs will be taken from the nose and groin, and that will be sent to the laboratory for testing. And you will get the result within a few days. Are you getting my point?
Okay. Yes.
Do you have any other concern?
Yeah, actually, what if my test confirms positive and I have the bacteria? What will happen next? That is one of my concerns. Someone else?
Well, Anu, do not worry. In case your results are positive for MRSA screening, we shall prescribe you some antiseptic body wash, and in addition to that, we shall also give you extra hygiene measures. Besides that, you will also be given an ointment for nostrils to apply for around 5 days, after which you shall be retested. I hope it's clear for you, Anu.
Okay. Yeah. Well, then even if my test is negative now, I'm worried I might pick up the bacteria in the hospital. Then probably I will not be able to have the operation.
Well, there is nothing to be overly concerned about it, Ms. Anu. I shall explain to you about the precautionary measures that we will be taking to prevent the spread of bacteria. We would be following some strict cleaning regime, like antibacterial hand wash. In addition to that, we shall be using some sterilization of equipment. I'll get a classroom
Okay.
monitoring.
And we will also ensure cleanliness and hygiene. Or you can say, and we will also ensure that all the facilities are clean and hygiene.
Can you just repeat it, please?
Okay. And we will also ensure cleanliness and hygiene. That is enough.
Okay. Well, Mr. No. Now, can I have your consent to go ahead with the screening?
Well, everything seems a lot clearer now. Well, you can go ahead with the screening now. Thank you so much. Wind up. Someone else wind up.
Apart from this, do you have any more concern?
No, actually, you've given me a very good idea. Thank you so much for your explanation.
Thank you.
Thank you.